Welcome to my channel. For your health, don't forget to click to subscribe. Reverse kidney failure without dialysis. Famous doctors reveal 5 natural foods that strengthen the kidneys, 5 tips to save kidney failure. 20 years of clinical notes of the director of the Department of Nephrology, a full-cycle kidney protection plan from food to life. When the creatinine value on the physical examination form soars, a programmer's kidney failure warning. At 3 o'clock in the morning, 35-year-old programmer AG stared at the creatinine, 187, on the physical examination report, and his hands couldn't help shaking. Half a year ago, he was still showing off his strong ability to hold urine in the circle of friends, but now the doctor told him, "Your glomerular filtration rate is only 45, and you will have to dialysis if you delay it any further." This is not an isolated case. The prevalence of chronic kidney disease in my country has reached 11.8, with about 120 million people suffering from it, of which 15 will develop uremia. What's more serious is that 90% of kidney disease patients don't know they are ill until they get an abnormal report like AG, and then they realize that their kidneys have been silently on strike for many years. As in the nephrologist, I see thousands of similar patients every year. But in my 20 years of clinical practice, I have also witnessed too many reversal miracles. A diabetic patient turned urine protein negative by adjusting his diet, and a patient with drug-induced kidney damage lowered his creatinine back to normal through scientific intervention. Today, I will use real cases and clinical data to reveal the truth, that eating the right food, doing the right thing, can reverse renal failure. 1. Silent decline of the kidney. Why is kidney disease always discovered too late? The compensation scam of the kidney. A healthy kidney is like two precision filters working in parallel. Each kidney has about 1 million glomeruli, and only 60 of them are usually in operation. When the glomerular filtration rate (GFR) drops below 50 of the normal level, the serum creatinine will rise, and the patient may have no symptoms at this time. 3. Ignored early signs. 1. Increased nocturia, from sleeping through the night to waking up in the middle of the night. Mr. Chen, a 48-year-old sales manager, has seen his nocturia increase from 0 to 3 times in the past year. He thought he was old, until he experienced fatigue and poor appetite. He went to the doctor and found that his serum creatinine had reached MOL. Nephrology data show that nocturia 2 times and lasting for more than 3 months increases the risk of chronic kidney disease by 40. 2. Persistent foam in urine, a kidney alarm mistaken for getting angry. Xiaolin, a 26-year-old clerk, had fine foam on the surface of her urine for 1 year. Her mother said, "Just drink more water," and she herself thought she was getting angry from work. It was not until the pre-employment physical examination found urine protein that a renal biopsy confirmed IgA nephropathy. At this time, the GFR it has dropped from 90 to 65 ml/min. 3. Unexplained fatigue. Kidney crisis attributed to subhealth. Auntie V, a 55-year-old retired teacher, has always felt too tired to move for half a year and thought it was menopausal syndrome. Until one day, she felt dizzy and fell down, and the examination found that her blood creatinine was MOL, accompanied by severe anemia. This is a common fatigue anemia combination in the late stage of chronic kidney disease. To the key to reversing renal failure, seize the golden 48 weeks of kidney repair. The self-repair cycle of the kidney. Animal experiments show that after mild renal damage, the kidney has significant repair potential within 48 weeks. If the renal tubular epithelial cells remove the damaging factors, such as dehydration and drugs in time, they can complete regeneration within 30 days. The repair cycle of glomerular endothelial cells is about 12 weeks. Clinical reversal case, from despair to hope. Case 1. How to regain a new life for a kidney destroyed by a folk remedy. Patient story: 42 Ms. Jiang 20 suffered from joint pain and took kidney tonifying herbs containing Aristolochia guanolone for 3 months based on folk prescriptions. She developed nausea and fatigue. When she was diagnosed, her blood creatinine was small and her urine protein was. She was diagnosed with Aristo, low-chic acid nephropathy. Reversal process. I stopped medication immediately and be hospitalized to correct electrolyte imbalance. II diet adjustment. Eat 150 g steamed salmon omega-3 supplement, 100 g blueberries antioxidant every day. II doctor's prescription. ACEI drugs to reduce proteinuria, combined with brisk walking 3 times a week. Results after 1 year, blood creatinine dropped to mol. Urine protein, GFR increased from 40 to 58 ml/min, and renal ultrasound showed that renal atrophy stopped. Case 2. Pull back from the brink. In the early stage of diabetic nephropathy. Patient story, 50-year-old taxi driver Lao Wang, with a history of diabetes for 8 years, was found to have microcephaly, uncia during physical examination 280 mg/20 for age normal 30. The doctor warned that, if you don't control it, you will suffer from kidney failure. Reversal action. Dietary revolution. Eat 1 small bowl of pumpkin seed and walnut paste for breakfast, add a portion of reed amaranth for lunch, and use kelp to make soup for dinner. Life adjustment. Stop and urinate after driving for 2 hours every day, and do 10 minutes of Kegel exercises before going to bed. Medical intervention. Strictly control blood sugar glycosited hemoglobin 6. 8 take ARB drugs. Re-examination after half a year, urine microhemoglobin dropped to 32 mg/20 for age. GFR increased from 70 to 78 ml/min. The doctor said successfully stepped on the brakes. 3-5 natural foods for strengthening kidneys, clinically proven kidney repair agents. Deep sea fish, omega-3 builds a protective barrier for the kidneys. Why is deep sea fish the first choice for kidney protection? A 2019 study in the American Journal of Nephrology showed that eating 3 chronic kidney disease patients who eat deep-sea fish have a 3rd time for slower decline in glomerular filtration rate than those who do not eat fish. Its core ingredient omega-3 DHA can inhibit the production of glomerular inflammatory factors such as IL-6, TNF, improve renal hemodynamics and increase glomerular filtration rate, reduce proteinuria and protect the integrity of the filtration membrane. Real case, salmon reverses proteinuria. Ms. Liu, a 38-year-old designer, has a history of chronic nephritis for 3 years and urine protein continues to be. At my suggestion, she ate 150 g steamed salmon twice a week. After 3 months, the urine protein dropped too, and after half a year, it turned to trace amounts. She joked, "I always thought that health products protected the kidneys, but I didn't expect a fish to be more effective." Guidelines for consumption. Preferred species, salmon, mackerel, sardines. DHA, EPA content on e.g. 100 g. Avoid pitfalls. Large deep-sea fish, such as sharks and swordfish, contain high mercury, so pregnant women and people with renal insufficiency should be careful when eating them. Cooking taboos. Deep frying will destroy omega-3. Steaming or baking is best, and lemon juice can be used to remove the fishy smell. Red amaranth, natural potassium kidney regulator. Red amaranth's dual kidney protecting effects. Each 100 g of red amaranth contains 340 mg of potassium and 120 mg of magnesium, making it a natural electrolyte balancer. For patients with early kidney disease, it can promote sodium excretion and reduce the burden on the kidneys. Each 100 mg of potassium can promote 30 mg of sodium excretion. Provide rich folic acid to prevent anemia common in kidney disease. 100 g of red amaranth contains folic acid G. Flavonoids contained can remove free radicals in the kidneys and reduce oxidative damage. Clinical story: edema solved by a bowl of amaranth soup. Auntie Lee, 52 years old, has chronic kidney disease stage 2 with mild edema. The doctor recommended that she limits alt intake, but she always felt tasteless. I taught her how to make red amaranth egg drop soup. 200 g amaranth, 1 egg, less salt. After drinking it for 1 month, the edema subsided and the blood pressure dropped from 140/90 mmHg to 130/85 mmHg. She was surprised and said, "It is milder and more effective than taking anti-edema medicine." Eating precautions. Blanching to remove oxalic acid. Blanching in boiling water for 1 minute before cooking can remove 60 of oxalic acid and avoid calcium deposition. People with high potassium should be careful when eating. People with renal failure GFR 30 ml/n need to control their intake. No more than 2 times a week, 100 g each time. Matching tips. Cook with foods rich in vitamin C such as tomatoes to promote iron absorption. Blueberries. Anthocyanins protect the glomerular filtration membrane. Blueberries kidney antioxidant war. Anthocyanins contained in blueberries, 163 mg per 100 g, are powerful antioxidants that can clear oxygen-free radicals in the kidneys and reduce damage to glomerular mesangial cells, inhibit the process of renal fibrosis and delay glomerular sclerosis, improve the energy metabolism of renal tubular epithelial cells and enhance reabsorption function. Patient testimony. Blueberries reduce your unfoam. 29-year-old programmer Xiao Wu was found to have microhemoglobin in urine during the physical examination 85 mg 24H, which is subhealthy kidney. I suggested that he eat a small bowl of blueberries 100 g every day. After a re-examination 3 months later, the urine microhemoglobin dropped to 40 mg 24H, and the urine foam was significantly reduced. He said, "Now eating blueberries as a snack is healthier than drinking coffee." Alternatives. Seasonal alternatives. Strawberries' anthocyanin content is about 1/3 of that of blueberries. Mulberries 110 mg of anthocyanins per 100 g. Storage tips. Fresh blueberries can be refrigerated for 5-7 days. Anthocyanins are more stable after freezing and can be made into blueberry milkshakes with sugar-free yogurt. Dosage control. No more than 150 g per day. Excessive intake may cause diarrhea, especially for those with sensitive stomachs. IV pumpkin seeds. Kidney cell repairer with zinc and magnesium combination. Kidney protection nutrition code of pumpkin seeds. Each 100 g of pumpkin seeds contains 1 mg of zinc and 212 mg of magnesium. These 2 minerals are essential for the kidneys. Zinc is involved in the synthesis of renal tubular epithelial cell repair enzymes. Zinc deficiency will lead to decreased repairability. Magnesium can relax renal vascular smooth muscle and increase renal blood flow. Studies show that renal blood flow is 20 higher in those with adequate magnesium than in those with magnesium deficiency. Case sharing. Nocturia improved by pumpkin seeds. 60 Zhu, a 20-year-old retired cadre, had chronic kidney disease stage 1 to 3 nocturia night and sore waist and knees. I asked him to eat 20 g roasted pumpkin seeds with shells every day. After 1 month, nocturia was reduced to 1 time night. After 3 months, the blood zinc level increased from 7 mol to 10 mol normal 7. 65/22. 95, and the renal function index was stable. He laughed and said, taking kidney tonifying medicine before was useless. A handful of pumpkin seeds solved the problem. Consumption suggestions. Original pumpkin seeds without salt and sugar, and roast them in the oven at 150 for 10 minutes for a more fragrant aroma. Grinding and consumption. Beat pumpkin seed powder and add it to oatmeal porridge to increase the absorption rate by 30. Calorie control. 100 g pumpkin seeds contain 490 calories, which should be included in the total daily calories. Obese people should eat half of it. VK-on-BU, the kidney scavenger of brown algae polysaccharides. K-on-BU's unique kidney protection mechanism. The brown algae polysaccharides contained in kelp have dual effects. Absorb uric acid in the intestine and reduce uric acid reabsorption. Clinical experiments show that brown algae polysaccharides can increase uric acid excretion by 25%. Promote the excretion of renal endotoxins through urine and reduce the burden of glomerular filtration. Clinical application: KMBU soup relieves gout renal crisis. Mr. Wang, a 45-year-old gout patient, has a long-term uric acid level of Moland, has uric acid kidney stones. I recommend that he drink kelp tofu soup twice a week. KMBU 30g, 100g tofu. Combined with a low purine diet, uric acid dropped to mol after 3 months, and kidney ultrasound showed that the stones had not increased. He said with emotion, "I always took uric acid-lowering drugs before, but I didn't expect that a bowl of soup could help." Precautions: high iodine content. People with hyperthyroidism should eat less. 100g of kelp contains g of iodine, far exceeding the daily recommended amount of g. Cooking method: soak for 2 hours in advance and change the water 3 times to reduce the iodine content. People with renal failure, no more than once a week, 50g each time. Dry product, to avoid excessive potassium intake. IV 5 core strategies for reversing renal failure from clinical to life. Dietary regulation, reduce the burden and increase efficiency. For the kidneys: 1. The golden ratio of low-protein diet. Chronic kidney disease stage 1 to 0. 8g protein kg body weight day, such as 48g per day for 60 kg. Equivalent to 2 eggs, 100g lean meat. Chronic kidney disease stage 340. 6g protein kg body weight day, of which 50 high biological value protein eggs, milk, fish, lean meat. Real case: protein diet reverses the process of renal failure. Ms. Chen, 58 years old, chronic kidney disease stage 3 GF, or 40 ml MN, used to eat 2 eggs 500 ml, milk 150 g lean meat every day, and the protein intake exceeded the standard. After adjusting to 1 egg 200 ml milk 50 g fish, combined with keto acid tablets, blood creatinine dropped from mol to mol after 6 months, and GFR stabilized at 40 ml MN. To detailed management from salt control to invisible salt. Real data: daily salt intake is reduced from 10 to 5g, and the risk of chronic kidney disease progression is reduced by 40. Salt control skills: use acid instead of salt, season with lemon juice and vinegar to reduce dependence on salt. Beware of invisible salt, 10 ml soy sauce 1. 5g salt, 1 pack of instant noodles, 5g salt. Cooking method: add salt when cooking, the salty taste is more prominent, and the amount of salt can be reduced by 30. II drug management: avoid kidney injury trap. 1 blacklist of nephrotoxicity drugs. Non-steroid ethantophyl antidrugs. Ibuprofen, aspirin. Long-term use increases the risk of kidney disease by 2-3 times. Chinese medicine containing Aristol, low-chic acid, Aristolophia guanid II, Aristolophia fang-G, has been proven to cause irreversible kidney damage. Some antibiotics, gentamicin, Amikan strong nephrotoxicity, only used when necessary. Patient lesson: renal failure caused by a painkiller. Xiao Zhao, a 28-year-old white-collar worker, took 5-6 tablets of ibuprofen every month for 2 years due to dysmenorrhea. Physical examination found that the blood creatinine was mol normal, 104, and was diagnosed with drug-induced kidney injury. After stopping the drug and adjusting the diet, the creatinine dropped to mol, but the doctor said, if you continue to take it, you may develop chronic renal failure. To the correct way to use kidney protection drugs. ACERB, such as losartan and perindiprib, not only lower blood pressure, but also reduce proteinuria and delay renal failure. Active vitamin D, such as colchicine, corrects the calcium phosphorus metabolism disorder of chronic kidney disease and protects the renal tubulus. II exercise intervention, activate the self-healing power of the kidney. Case witness: kidney vitality brought out by brisk walking. Mr. Lin, a 40-year-old middle school teacher, has chronic kidney disease stage 2. He insists on brisk walking 5 times a week, 40 minutes each time. After 3 months, his GFR rose to 70 ml and his urine protein decreased from to a trace amount. He said, "I used to think that exercise hurts the kidneys, but now I know that scientific exercise is to protect the kidneys." IV dual control of blood sugar and blood pressure, cut off the accelerator of renal failure. 1 kidney-friendly sugar control for diabetic patients. Sugar control target, fasting blood sugar for 70 mol, glycosited hemoglobin 7.0. Key actions: eat deep-sea fish 3 times a week. Replace desserts with blueberries and take a 20-minute walk after meals. 2 kidney protection and blood pressure reduction method for patients with hypertension. Blood pressure reduction target, blood pressure of patients with chronic kidney disease 130/80 mHg. Preferred drugs, ACE/ARB such as benaceplar, which can both reduce blood pressure and protect the kidneys. Clinical example: renal failure crisis reversed by dual control. 55-year-old Lao Zheng, diabetes, hypertension, urine protein, blood creatinine. After strict sugar control, glycosited hemoglobin 6.5. Blood pressure reduction, benaceplar 10 mg day. Blood pressure 125/75 mHg. Kidney protection diet for 1 year, urine protein, blood creatinine dropped to mol. GFR increased from 55 to 60 ml/min. Toxin management, lighten the burden on the kidneys. 1 dietary revolution of intestinal detoxification. Principle: 70 of the toxins in the body can be discharged through the intestines, and optimizing the intestinal flora can reduce the detoxification burden on the kidneys. Action plan: eat 30 g of dietary fiber such as 1 apple, 50 g oatmeal, 100 g celery every day, and supplement probiotics such as yogurt. 2 auxiliary therapy for skin detoxification. Applicable population: chronic kidney disease stage 3, mild toxin accumulation. Method: 38-40 warm water sitting bath. 20 minutes each time, 3 times a week. To promote sweat to excrete toxins, pay attention to hydration and avoid dehydration. 5 pitfalls on the road to reversing renal failure. Don't step on these misunderstandings. Eating kidneys to replenish the body. The more you replenish, the more you hurt your kidneys. Mr. Zhao, 42, heard that eating kidneys can replenish the kidneys, and dates fried kidneys twice a week. As a result, a physical examination found that his uric acid level was mol, and a kidney ultrasound showed tiny stones. In fact, animal offal is a high purine and high phosphorus food. Eating it is equivalent to poisoning the kidneys for patients with chronic kidney disease. II protein powder replenishes the kidneys, but it results in proteinuria. Xiao Wan, a 29-year-old fitness coach, drank 2 spoons of protein powder every day for 1 year to increase muscle mass. A physical examination found that his urine was protein and his blood creatinine was mol. A nephrology examination showed that excessive protein increased the burden of glomerular filtration, leading to fitness-induced kidney damage. In fact, a healthy person's daily protein requirement is only 0.8 gkg, and excessive intake can damage the kidneys. Chinese herbal remedies for kidney disease. The more you treat it, the worse it gets. Auntie Liu, 56, believed in a secret recipe handed down from her ancestors, and took Chinese medicine containing cinnabar and realgar for 3 months. She developed nausea and fatigue. When she went to the doctor, her blood creatinine had reached mol, and she was diagnosed with heavy metal kidney damage. Many Chinese herbal remedies of unknown origin contain nephrotoxins ingredients, such as aristil, loic acid and heavy metals. Blindly taking them is equivalent to chronic suicide. IV holding urine exercises kidney function, but it causes pyelonephritis. In order to reduce the number of stops, Lao Wang, a 32-year-old truck driver, often held his urine for 5 hours, and even used drinking less water to cooperate. Half a year later, he developed back pain and fever, and was diagnosed with acute pyelonephritis. Renal ultrasound showed hydronephrosis. Long-term holding urine not only fails to exercise kidney function, but also causes urine reflux, bacterial growth, and induces serious infection. The Famous Doctor Clinic, 10 common questions about reversing renal failure. Can reversal be achieved if urine protein is detected? Doctor's answer: urine protein is an early stage of renal damage. With timely intervention such as low-protein diet, deep-sea fish, ACE drugs, 80 of patients can turn urine protein negative within 3-6 months. I once treated a teacher with urine protein. After 4 months, the urine protein disappeared through dietary adjustment, brisk walking 3 times a week. Do I need to take medicine if my blood creatinine is small? Doctor's answer: the cause must be determined first. If it is acute renal damage, such as dehydration, drug-induced, it may heal itself after the cause is removed. If it is chronic kidney disease, it is necessary to decide whether to use medicine based on indicators, such as urine protein and blood pressure. There was a patient with blood creatinine of mol. After half a year, the creatinine dropped to mol through strict salt control, low-protein diet, avoiding medication. How to supplement omega-3 for deep-sea fish allergy? Doctor's answer: you can choose algae oil DHA supplements, plant-derived, suitable for vegetarians and those with fish allergies, 200-300 mg per day. Or eat walnuts, each 100 g contains 2 g of linolenic acid, which can be converted into omega-3. But be aware that walnuts are high in calories and should not exceed 20 g per day. Is it possible to reverse chronic kidney disease stage 3? Doctor's answer: it is difficult to completely reverse chronic kidney disease stage 3 GFR 3059 mLM into normal. But active treatment can significantly slow down the progression. I have a patient with a GFR of 40 mLM. After 5 years of kidney protection measures, the GFR only dropped to 35 mLM, which is much slower than the average annual decline of 5-8 mLM. Will eating pumpkin seeds increase blood lipids? Doctor's answer: pumpkin seeds contain healthy fats, 70 unsaturated fatty acids. No more than 20 g, about 1 handful per day, will not only not increase blood lipids, but will help reduce low-density lipoprotein. There was a kidney patient with high blood lipids who ate 15 g pumpkin seeds every day. After 3 months, blood lipid indicators improved. KUMBU is high in purine. Can gout patients eat it? Doctor's answer: KUMBU is a low purine food, 13 mg of purine per 100 g. Gout patients can eat it in moderation 1 to 2 times a week, 50 g of dry product each time. But please note, KUMBU is high in iodine, so people with hyperthyroidism need to limit their intake. How to protect kidneys during exercise? Doctor's answer: I drink 500 ml of water 2 hours before exercise to avoid dehydration. I avoid high-intensity resistance training, such as lifting barbells, to prevent a sudden rise in blood pressure and damage to the kidneys. If muscle soreness or soy sauce-colored urine occurs after exercise, seek medical attention immediately. Beware of rhabdomyolysis. Can patients with renal failure eat fruit? Doctor's answer: choose low-potassium fruits, such as apples and pears, no more than 200 g per day. Patients with renal failure GFR 30 mLM need to adjust according to blood potassium levels. And limit or avoid high-potassium fruits, such as bananas and oranges if necessary. How long does it take to see the effect of reversing renal failure? Doctor's answer: acute kidney injury. After timely treatment, creatinine can be seen to decrease within 1-3 months. Early stage of chronic kidney disease, adhere to kidney protection measures for 3-6 months. Urine protein and GFR can be seen to improve. Middle and late stage of chronic kidney disease, long-term persistence is required, with the focus on delaying progression. Is it necessary to have a fistula before dialysis? Doctor's answer: hemodialysis requires vascular access fistula, or catheter, while peritoneal dialysis can be performed through abdominal catheter shianti. It is recommended that patients with chronic kidney disease stage 4 GF are 30 ml and discuss with their doctors in advance. Peritoneal dialysis protects residual renal function better and provides more freedom in life. VI Prohodages Home Kidney Care Plan, from testing to conditioning. I 3-step home testing method. 1. Self-kits with urine protein test strips. Operation points: dip the test strip into the urine for 1 to 2 seconds in the morning midstream urine, and compare it with the colorimetric card after 60 seconds. If or above appears, you need to see a doctor as soon as possible to check the 24-hour urine protein quantitative. 2. Daily blood pressure record. Measurement time: after getting up in the morning and before going to bed at night. Measure after sitting and resting for 5 minutes. Record focus: the ideal blood pressure of patients with chronic kidney disease is 130/80 mHg. If it is 140/90 mHg for 3 consecutive days, the treatment plan needs to be adjusted. 3. Dynamic weight monitoring. Monitoring frequency: patients with edema should weigh themselves every morning after emptying the bladder. Warning signal: weight gain to kg within 1 week. Water retention may occur in the body, and you need to reduce water intake and seek medical attention. II 1-week diet example for kidney protection diet. Monday. Breakfast: oatmeal porridge 50 g oatmeal, 1 boiled egg 10 pumpkin seeds. Lunch: 150 g's, sea bass 200 g stir, fried red amaranth 100 g rice. Dinner: kelp and tofu soup 30 g kelp, 100 g tofu cold cucumber 50 g grain rice. Snack: 50 g blueberries. Friday. Breakfast: whole wheat bread 150 ml, sugar-free yogurt 50 g blueberries. Lunch: 150 g salmon sashimi broccoli with garlic 80 g brown rice. Dinner: winter melon and red bean soup stir, fried spinach half a corn. Snack: 5 walnuts half an apple. IIACU point massage to protect kidneys. 1. Press and drop the Shenshu point. Location: no. Inches about to finger widths below the lumbar spinous process. Method: press and drop with the thumbs of both hands, 36 times on each side, preferably with soreness and swelling. Effect: regulate kidney qi, improve kidney function, and relieve soreness of waist and knees. To rub the waist high. Location: both sides of the waist, 3-5 inches below the 4th lumbar spinous process. Method: after rubbing the palms of both hands to warm them up, rub the waist up and down until the local heat is felt. Effect: promote blood circulation in the kidney area and enhance the metabolic capacity of the kidney. Atrial reversal story: from edge of dialysis to normal life. A case: neglected urine foam almost ruined life. Patient story: a 30-year-old advertising planner found that the urine foam lasted for half a year, but he didn't pay attention to it because of his busy work. Until one day, a physical examination found that the blood creatinine was more than the urine protein, and was diagnosed with chronic nephritis. The doctor said, if you delay for another half a year, you may need dialysis. Reversal action. Dietary revolution: say goodbye to takeout, cook by yourself, eat deep-sea fish 3 times a week, 100 g blueberries every day. Lifestyle adjustment: drink 1500 ml of water every day, stop holding urine, and go to bed before 11 p.m. Medical intervention: take ACI drugs and have regular checkups. Results after 1 year: serum creatinine dropped to mol, urine protein GFR increased from 45 to 60 ml/min. Amine side: I used to think that youth is capital, but now I know that kidneys cannot withstand squandering. Case: Jetty counterattack of patients with diabetic nephropathy. Patient story: 48-year-old taxi driver Lao Zhu, who has had diabetes for 10 years, has poor blood sugar control, and has increased nocturia and fatigue. Examination revealed 300 mg 24H of microcurally uncia un mol of serum creatinine. Reversal plan: Diet: eat pumpkin seed and walnut paste for breakfast, add a portion of reed amaranth for lunch, and cook kelp soup for dinner. Medical treatment: strictly control blood sugar insulin treatment, glycosylated hemoglobin 6. 8. Take ARB drugs. Exercise: do squats and casual exercises during parking breaks every day. Re-examination after 2 years, your microhemoglobin dropped to 40 mg/h, blood creatinine stabilized at mol, and GFR increased from 60 to 65 ml/min. Lao Zhu said, "Now passengers say that I look better than before, but actually my kidneys have gotten better." Ex-doctors, final advice. 3-level prevention for kidney health. Primary prevention, prevention before illness. Basic measures: drink 1500 to 1000 ml of water daily, eat a low-salt diet 5 day, and control blood pressure, blood sugar, and blood lipids within normal range. Dietary recommendations: eat deep-sea fish 2 to 3 times a week, 1 handful of pumpkin seeds a day, and eat blueberries under amaranth in moderation. Exercise prescription: 150 minutes of moderate intensity exercise, such as brisk walking and swimming per week, to reduce the risk of chronic kidney disease by 20. Secondary prevention, early diagnosis and early treatment. High-risk screening: patients with diabetes and hypertension should have your routine urine, microhemoglobin serum creatinine, every 6 months. Early intervention: if microhemoglobinuria is found, timely use of ACE/ARB drugs can delay the progression of kidney disease by 50. Dietary adjustment: once kidney disease is diagnosed, immediately start a low-protein diet 0.86 gkg day supplement ketoacides. Tertiary prevention, delaying progression. Dietary treatment: patients with chronic kidney disease adopt a low-protein diet 0.68 gkg day and add ketoacides to delay the decline of renal function. Complication management: correct anemia using erythropoietin, control calcium-phosphorus metabolism disorders taking phosphate binders. Dialysis preparation: patients with uremia should understand the dialysis method hemodialysis versus peritoneal dialysis in advance and make psychological and medical preparations. As an afloragitals, I have seen too many silent kidneys, failing without knowing it. AG, a 35-year-old programmer, once thought that strong ability to hold urine was a skill until his creatinine soared to read, and he was awakened. Lao Wang, a 50-year-old, attributed the increase in nocturia to old age and missed the best reversal period. But I have also witnessed countless hoax. Ms. Liu, who insists on eating deep-sea fish, has negative urine protein. Lao Zhu, who eats pumpkin seeds every day, has less nocturia. Amin, who takes urine foam seriously, has recovered kidney function. These real cases prove that the kidney has a strong self-healing power as long as you give it the right support. From today, you might as well make 3 changes: add a handful of pumpkin seeds to breakfast, eat a portion of reed amaranth for lunch, and drink a bowl of kelp soup for dinner. Spend 10 minutes brisk walking every day, and do 5 minutes of kidney massage before going to bed. These small actions are all injecting new life into the kidneys. Finally, I would like to say to you, although kidney disease is silent, it is not invincible. Pay attention to every urine signal and every food choice, and you can let this pair of life filters work for you healthily for a lifetime. If you have any questions about kidney protection, please leave a message for consultation. Let's protect the kidneys together and stay away from dialysis.